All right, good morning, folks. It is September 29th of 2023. This is Coffee with Community Services, Alta California Regional Center's weekly vendor meeting. My name is John Decker, the Director of Community Services. We've got 48 folks logged in so far. We'll go ahead and do some introductions for staff. So I see from our Community Services Department, I see our manager Helen on this morning. Good morning, Helen. And our housing specialist Rhonda is on. Good morning, Rhonda. And client services manager BJ is on. Good morning. And I see Leah and Dee Dee from Community Services. Good morning. And let's see, Community Services, I see Tom Casper on and Shauna, good morning. And Client Services Managers, I see Carol and Cindy on, good morning. And Gary and Sydney from Community Services, good morning. And let's see, I got a whole row of folks here. I got Scott on, good morning, Scott from Community Services. My assistant Zach is on, good morning, Zach. And our HCBS specialist Kylie is on. Good morning, Kylie. And Beverly from Community Services and Elijah from Community Services. Good morning. And our intake and clinical director Camelia is on this morning. Good morning, Camelia. Let's see. Jan Bonner's on. I see Jan. Hey, Jan. Good morning. All right. For Community Services, let's see. Adriana's on. Good morning. I like to announce people just as they take drinks of their drink. And I see Ethan on from Community Services. Good morning. And Jason, our lead Community Services specialist, is on. All right, let's see. And I see some other service coordinators on. I won't run through all of them because I see more popping up, but I see Barbara and Sophia on. Good morning. All right, let's jump over to our agenda for today. We have, I think, we're going to get Jordan on and we're going to do an update on our CRDP survey that closes today, right, Dee Dee? Isn't today the day? I think so. All right. And then we're going to talk a little bit about the DSP Collaborative and our job fair that we have coming up. And then we are also going to be talking about the new $20 an hour minimum wage for fast food workers. Talk about that as well. Certainly heard from a lot of providers as it relates to that, with the governor signing that. And then we got some information about the trailer bill as well. So first, I will let anyone know that if there's something that you want added to this, please don't hesitate to put it in the chat. And I will put a little note on here to do a reminder about the Supported Life Conference, because Supported Life Conference early registration ends, I think, today, or yeah, it ends in September. So you want to get your early registration in if you can. All right. So I will go first off. I want to share some new information. So last week we shared with folks, well, we've been sharing for the last month about the upcoming job fair that we're going to be having at Sierra College, but now we have the ability for us to have you sign up for it. And so I'm going to navigate to the DSP Collaborative website. All right. And right, are we seeing the DSP Collaborative, Leah? Are we seeing the DSP Collaborative website? All right, thumbs up, perfect. So again, many of you are familiar with this. This is the free job board that is offered to all regional center providers. Certainly, we have a lot of you utilizing it, but would love to see even more people utilizing it. We do have a banner at the top for our upcoming job fairs at Sierra College. And so if you go into the news and events page, that's where you can put the flyer. And this is the one for employers, and this is the one for job seekers. So what I am hoping is, and I will drop this into the chat for everyone, is that you will take this flyer and for the job seekers one, blast it out to people on your social media. We would really appreciate that. And then for those of you that are employers, we would love for you to download this, go onto our register right here so that you can be able to participate in the DICE Industry Career Expos. So again, that's coming up November 7th at Sierra College. It's going to be right in the cafeteria. We think that there's going to be a whole lot of foot traffic that's going to be in there. And our regional center has once again made the determination. We want to be very supportive of this event, and so we are going to be funding advertisement for this event on KCRA as well. We agreed last week. So again, November 7th at Sierra College for those of you that are employers. Is there any questions about that? We will say, you know, when we did this last time, we had people from all kinds of different types of service providers that were there. You know, we had all the way from environmental accessibility, we had children's behavioral programs, and then we had some just residential care home operators that were out there. So again, just want to encourage folks to make sure that you are, if you are interested in that, that you sign up and we can get you a booth. Carly, I think last week said that we indicated that we're going to have 50 people there. I would love to have way more than that. My understanding is it's a very large place and it can hold a lot of folks. So again, you'll have a table up there and there's no cost for you to participate either in the job fair and certainly no cost for you to participate in the DSP Collaborative website. Additionally, you know, again, Sierra College is really going to be trying to funnel traffic into the job fair as well. So I think as we are trying to create, we talked about this during our board meeting a little bit yesterday about the necessity to create more visibility for this job field. Garrett from our provider advisory committee, who's one of our vendors, did a good job talking about that. And I think that's one thing that is a great benefit to doing these types of job fairs over at the, you know, community colleges, is that it really does raise that awareness while people are still thinking about what kind of jobs they want for the future to get into the field. So again, just want to encourage folks to participate in that one. And Michelle Duchesne is going to make sure that that is updated onto our events calendar. Now that we have the flyers on the website, it'll be a good time to have those links put up there. All right, and I'll jump in the chat real quick. And here we go. All right. And let's see here. So we also had discussions. Let's see. And I'll just ask if anyone's on here. Was there any service providers that attended the quality improvement, quality incentive program meeting that DDS had? Do we have anyone on that is maybe interested in talking about it at all? That, because otherwise I can give you a summary of kind of what occurred and updates. A lot of this stuff is not necessarily completely new, but the quality incentive group has been working a long time to try to address what they call the 90-10 issue, which is that with the implementation of the full rate study, that there's supposed to be a 10% incentive payment that is put in there. And the challenge with the way that it was written into the law is that it requires like us to have these for all of our different service codes. And there's so many different types of services that the regional center vendors, there's so many different needs that people with developmental disabilities have. And so for them, it has been a huge challenge being able to, it's been a huge challenge for them to be able to get all of those measures created in order to be able to meet the time frames so that everyone, in essence, can get the full amount that they should be getting come July 1 when we have the change over to the final rates. So I'm going to drop in the chat real quickly. This is the PowerPoint from the presentation that you can get. And so just to kind of give you, some of the information that was shared in there is Pete Cervinka, who is kind of over the data side over at DDS, talked to, oh my gosh, sorry, my sheet with the information just moved all over the place. He discussed the different priorities within the developmental disability services system right now and how we have, again, so many different, in essence, charges right now. We are unifying the rate models. We're trying to figure out a way to standardize, vendorizations, and then also looking at ways to determine what are the factors that are considered quality for all these different services, and how can we figure out what some of those measures are. So the department, and I've shared about this previously, but now they've begun having additional discussions about it, and I'll see if they have any good slides about it. But they are creating a service provider agency directory. And I've shared about this previously because DDS presented to it, but now again, a little bit more information is coming in at that. It's even seeming to come sooner than we thought it was going to. So Aaron Christian, who's the assistant deputy director at DDS that is overseeing this particular project for the service provider directory, also used to be the community services director at San Gabe Pomona Regional Center and worked in their community services department for years. So I will just say we have someone at DDS that has worked really closely with service providers over the years. So that kind of makes me feel pretty confident in what they're developing here. So again, what is coming together is that the real requirements that the service providers are going to have to meet in order to get that quality incentive for this year is participation in this service provider agency directory. So the directory would provide more public information about service providers and support quality assurance work and oversight with licensing agencies. The goal for this year, so for this year's quality incentive activities tied to the portal that they're going to be developing, is for you to log into the portal to register and to validate the information regarding the individual vendorizations, the management structures, and the teams. And I know I've described this previously, and Eric unfortunately is on the front page of my screen. So for example, if UCP has multiple vendorizations, I believe that one of the activities that they want to do is to verify some of those connections that exist and have people do that within the vendor directory. There was feedback that came out during the meeting about the fact that, regional centers already have all of this information anyways, but we certainly know that things do change. We have so many different service providers, and the department wants to ensure that we have a very clean, I think, data set of information. And the best way to do that is also to have the service providers go in and verify that information. So the work group members, they got invited to ask those questions, and that was like one of the biggest ones that came up. The portal that they are developing is looking at being initially completed in October of 2023. Previously, they had said January 1 was when they wanted to get the activities going, and I thought that's meant when they meant that they were going to have the database up and going. But it sounds like they're going to get it developed earlier, which is good. That should hopefully give us enough time in maybe November and December to do trainings on what the expectations are of the service providers. Because my understanding, and if anyone was in the meeting or knows something different, is that as much as possible, they want to try to complete these activities by April so that we have the rest of that period of time to make sure that we have everyone's billing, verified, so that July 1, we don't have anyone not getting the incentive payment. So let's see if there's anything else that came up out of that as well. They talked about the quality improvement measures. They talked about the DSP workforce survey. Apparently there was 1,800 new surveys that were submitted, and UC Davis is working on a dashboard of all of that information. There was additionally some additional. There was also some quality incentive measures that were made related to preventive medical treatment for people that are in the more medical type of homes. So the ARFPs, the adult residential facilities for people with specialized healthcare needs as well. So again, this group has been working for, I know, at least a year together, trying to figure out what the quality incentive measures were going to be. And this is kind of where they landed for something that I think they believe is attainable by our service providers. So as soon as we have information from the department about any trainings that are going to become available as it relates to the database, I just guarantee you the department is going to be really pushing us to make sure that we get the information kind of out there and to you. And we want to make sure everyone has an opportunity to get it filled out and gets the incentive payments. So that is what they got out of the quality incentive group. Again, I will also say, I believe that doesn't mean that's the only quality incentive measure that they can implement. They can implement additional measures in the future, to my understanding. It's just this was the low-hanging fruit measure that they felt they could get put in place so that we wouldn't have any providers that ended up, losing on this end. All right, Jordan, we have Jordan back. And Jordan, are you able to bring up the CRDP stuff as well? I'm going to make you a co-host.
That'll be perfect. I am putting the link in now, and I will share my screen.
I was living dangerously. I didn't have a co-host for so long.
Oh, I'm sorry, boss.
The meeting could have ended.
All right, are you guys seeing our website?
We are.
Okay, excellent. So this might be a repeat for some of our folks who attend coffee regularly, but it is a really important time of year for our regional center in regards to developing resources for our clients. So as we know, every fiscal year, the regional centers put forth a community resource development plan to Department of Developmental Services, requesting startup funds to really target specific needs that we have in our communities, right? And it's really important for us to hear from our community regarding that, all of you guys being very important stakeholders. So we have the survey posted. Today is actually the last day for our survey. As some of you know, we've had it up for a couple weeks, so I really encourage you to follow that link, complete the survey to let us know what unmet needs you think that we might have in regards to development, or if you have a lot of experience in a certain like accessing a certain generic resource. For example, if you have barriers accessing generic resources, kind of give us some information on what that might be so we can help develop resources to fix that. We will be sharing the results of our stakeholder feedback on October 17th. We're just going to do a virtual meeting from 1 to 2:30. The Zoom link is right here on the website. We would love to have all you guys join so we can share our data and let you guys know what the community's thoughts are in regards to our needs for development. When we develop our community resource plan, we take our stakeholder survey and internal data that we've collected in regards to unmet needs to make those proposals. So we'll keep all of you guys informed, and we'll always have the information regarding what our formal plan will be on our transparency website. So I'll continue to provide you updates at Coffee with Community Services about what our plan will be. We'll be providing that to DDS on October 20th. So we'll be able to share it with you guys after that. That's it.
Awesome. Thank you very much, Jordan.
Yes.
Again, please, folks, you are the ones that are in contact with our clients every single day. You are the ones that are familiar with what people are waiting for. You are familiar with what gaps exist out there. And so for you as service providers, it is like imperative that we get your feedback about these different things. Our service coordinators do needs assessments. We actually have a new needs assessment program that we've even developed for our regional center that we think is going to give us even better data. We certainly, we sit in committees, we hear what these needs are, and, but again, the value of hearing from our service providers, is right up there with hearing from our clients and families. So just cannot encourage you enough to do this. And thinking of things that we haven't done before, thinking of like new and innovative things, thinking about something that exists somewhere else that you want replicated in our area, because this is about using startup funds. This is about something that people can't probably normally get off the ground, but maybe they can if we give them some money to be able to do something. And it's not all about just developing new care homes and developing, new day programs. Like there's a lot of other things that people need as well. But though we certainly know we need care homes and we need day programs as well. So, anyways, all that to be said, just really want to encourage folks to please fill that out. We take it very seriously, and hopefully we'll have a lot of responses to go over. I know Jordan set up the meetings for us to review things. So any questions about the CRDP stuff? I know we went over the priorities from DDS, which seems to be almost everything. It's very broad what we can do under there. So, all right. Let's see, I will check the chat real quick. Thank you very much, Jordan. Yeah, thank you very much for dropping that in the chat as well for our public meeting. All right. So I think I mentioned that I wanted to go over the trailer bill language real quickly, and I don't know that I have the link to send this quite out to folks yet, but I definitely, the Association of Regional Center Agencies has done their summary. I've kind of already given some of this information out, but there's just a little bit more, and I will share my screen real quickly. Of course, our friends at DDS, or not at DDS, but even ARCA, sometimes they release things on Friday afternoons. And so this came out last Friday to take a look at. And so are you guys seeing the ARCA logo there at the top? And all right, perfect. So this is SB 138. I think originally we said it was going to be an assembly bill, and it ended up being a Senate bill. And this is the developmental services trailer bill language. We talked about it a little bit with our management team, I think I remember, but there is a few things that are kind of interesting. So this is related to the development of complex needs homes on the former grounds of Fairview Developmental Center. Gosh, I think it was back in April or May. I testified in front of the Senate, I think it was the Senate, about this area because people were very concerned about basically building new institutions on Fairview's campus. And so some of the things that got worked into this are some protections, even for doing things like seclusion and restraints. But they did allow some ICFs to be built, intermediate care facilities on Fairview's campus as well. Our population is at over 400,000, and though we in no way want to have people segregated and institutionalized in any way whatsoever, in some cases, some of our clients are in prison. Some of them are in state mental health hospitals right now. Some of them are very long-term in institutes for mental disease. And I think looking at a kind of a step-down approach of moving people from there into a smaller, more home-like ICF setting, even if it is on the campus of the former developmental center, I think would be probably preferable to a lot of those other situations that clients could be facing. So that being said, we shut down the developmental centers for a reason, and we would really hate to see that become more of a default to putting people in those larger congregate settings. All right, so this one's interesting. This is 4418.7. It talks about placement of at-risk regional centers and regional resource development projects will have to continue to work together to identify alternative services and supports. And so I think this is the first time where I saw that like enhanced SLS was actually written in there. And so it's basically before you consider institutionalizing someone, see if you can put them, use the kind of a housing first model, put them into housing, and then just throw in as many services as you can on top of them, which works sometimes with varying results, right, Carol? Varying results. All right, and a new section for safety net plans. The process related to individuals at risk of needing admission to complex needs homes is delineated, as are the processes for such commitment, which cannot exceed past 18 months in duration. Again, that's one thing that when the state closed down the state institutions and they created a bunch of these smaller acute crisis type places for people to live, everyone wanted to ensure that we didn't end up having folks that were locked away in these very restrictive environments for years and years and years. So that's why they put in these restrictions for the shorter term stays for folks, because you're not always getting all of your choices when you're in a high level home like that with that level of support. And so you want to ensure that that's not an ongoing thing forever. The next thing is that the legislative intent that regional center services be person-centered, more uniform, consistent, and equitable, and also that DDS directives can't interfere with the individual program planning team's discretion and have to be consistent with the Lanterman Act. So there was an expanded authority given to the director of the Department of Developmental Services to issue directives. Those of you that work at the regional center and those of you that are service providers know that these directives, I don't know that they didn't necessarily come out of nowhere, but they became a part of our life very quickly during COVID. And it really, because of the state of emergency that was going on, so many different changes and directions that we got from the department that came through a directive. With statewide, there was a lot of discussion about giving the department director authority to do even broader directives to the regional centers. It was granted, as I mentioned, but there is something in there that in essence says you can do that, but it doesn't trump the planning team's discretion, and it doesn't trump the Lanterman Act. And so it has to be consistent. Let's see, developing data measures to promote service access and equity, as well as standardized respite assessments, IPP processes and templates, vendorization procedures and intake processes concerning intake, and new data has to be gathered. And so I don't believe that they've given us the information yet about the new intake data that they are planning on gathering. Camelia is shaking her head no. Camelia, do you know if they're going to be reaching out to the regional centers, or do you know if they're already working on that at all, or?
I've not heard from ARCA directly, so I don't have a conclusive response on that.
And I haven't either. Obviously, we've heard about the work that's going on about the IPPs, that the directors of client services, I believe, are working on. I know for the vendorization stuff, the community services directors have been working on that as well. I know we went over the timelines in this group. I will be honest with you, people get concerned about the loss of autonomy that regional centers have, but I don't really have a great justification why Valley Mountain Regional Center would have different vendorization requirements for a service than Alta does. So again, I think we have separate regional centers for a reason. We need to be responsive to the needs of our community, but standardizing some of these things really makes sense. And as if I was a service provider, many of you serve multiple catchment areas, and it can be very challenging. So this is one of the reasons why I've shared with folks, because we have brought on a transportation broker at our regional center, that we're not changing any of the requirements for vendorization right now for our regional centers. We're not changing any quality assurance because the state is all looking at standardizing this stuff right now. And we're not looking at trying to making any changes that are just going to have to get changed again, possibly down the line. And again, I can't see this doing anything but benefiting our service providers and our clients, because they're going to have, I think, a much greater opportunity to be able to serve different catchment areas too, be able to move those vendorizations around. So let's see, DDS has to define and examine generic services and look at ways to help improve access. Again, that was another big discussion about the expansion of generic services and making sure that those are given during planning team meetings. And I think there's a bunch of things that are going on related to that as well with regional centers to try to figure that out. Might have something to share with you all in the future. Nothing right now though. After the initial 15-day intake process, an individual has to be either found eligible or the regional center has to start the normal assessment process. Notifications are required. Camellia, can you touch on that at all?
Yeah, I know you asked last week, I think it was last week, time is just ticking, about the about that section. And I believe the emphasis is on the notifications are required. When somebody comes through, and specifically after the 15-day, if it's determined that we're not bringing them through because we don't have records, anything to support a suspicion of a belief of a developmental disability, then they have to receive formal notice that we're not moving forward. So not just the assessment piece later, which is standard across the state, if someone's determined not eligible, you give, notice of due process, but it's at the front end after the 15 days.
Excellent. Thank you very much. One of these days we need to have intake, Camellia go over intake numbers at Coffee with Community Services, just so that I think, well, I didn't realize, yes. I pulled up the list, and I've been saying to folks, with intake, we're going to hit 30,000 clients by the end of this calendar year. How many times have I said that, like in this meeting? We hit 31,300 like 2 months ago. We are with intake. Yeah. We're already blasted past that. And so, I mean, we're going to hit 30,000 with Lanterman eligibility here at some point soon. So it's crazy. But maybe we can talk about that, because again, I think that illustration of the intake numbers will help folks understand why we are doing these big pushes for service providers for our little kids and those types of things. So, all righty.
Absolutely. Big numbers mean more service needs.
Right? Yeah, absolutely. Okay, admission to complex homes automatically expire after 6 months unless specific actions are taken, which can extend the commitment to no greater than 18 months total. Again, I hope you're getting a theme here that they do not want people re-institutionalized for decades like used to go on previously. Again, you can go into the complex needs homes, and let's see, anything else? Nope, that's it for this trailer bill. So again, on, like Jordan's side of things, or, we have a specialized court liaison position, Janice's position, like that, they're really involved with those types of, admissions. We don't have a ton of those, nowadays. One thing that has made a big difference is, Dee Dee and the rest of the, CPP team have been building these specialized homes that have allowed us to be able to serve people in our local community instead of putting them into, some of the acute crisis settings and the star homes. We still use them as well, but thinking about years ago when we had so many people that were at College Hospital and so many people that were down at Sierra Vista Highlands, and how many of those ended up going to Carol's unit afterwards. Sorry about that, Carol. She's been a busy one for years with us, taking very, very challenging needs individuals, and definitely doing a very good job. Her team specializes in that stuff. All right, so we got the DSP job fair, we got the trailer bill taken care of. Let's see. I want to entertain a discussion here. I know several people have either called me or sent me messages about the $20 an hour minimum wage for the fast food workers in California, and so wanted to see if folks had a thoughts or they want to share anything. I will tell you, I certainly am concerned about the impact that that would have on us. I also think we will probably drastically see a shift in fast food and kiosks going up instead of employees being there. But that being said, just wanted to see if anyone had any feedback or any concerns that they wanted to bring up. We're monitoring it. I would say we have concerns. We certainly know that we're trying to attract people to this field, and that would be a lot of health and safety waivers for Norma to write to keep up with that hourly rate. So. All right, well then, enough of that fantastic news about the minimum wage going up for fast food. So let me go to one more area that I wanted to make sure that I covered, which was we do have our newsletter coming out, and in our newsletter we are featuring once again the Supported Life Conference. And so everyone sees the Supported Life Conference on here, and it's got the conference brochure, and just want to encourage folks to go. I heard that DDS is sending 20 staff over there, which is huge. I don't know when the last time they sent that many people, but they also probably have a ton of new staff. Again, this is a great opportunity in Sacramento to participate in this. I know I will be presenting with Rhonda and also with some members of our local community, some family members, and we're going to be talking about strengthening community housing advocacy through family partnerships. And then I believe I'm also going to hop in for the DSP collaborative discussion with Tony Anderson as well. And Joey Travolta will be there. Joey's been working a lot on our projects. Tony will be there. Unfortunately, Lori will not be there. Lori is actually going to be out of town that week, so she will not be there. But Eric Champa, who's been very important to this collaborative that we've been doing, has agreed to do it. And so we didn't get an updated brochure, but maybe we can do a little Photoshop and we'll put Eric's picture right there instead of Lori's. But Harry Bruel's going to be there from Path Point. He's presented to this group before in the past, and then Don Parada will be there as well. So again, just a plug for the Supported Life Conference. Hopefully folks will be interested in participating in that. All right, I am going to jump over the chat to see what we have. Oh, there we go. DSP stipend. Alta contracts for providers. Michelle Duchesne.
Yes, I didn't see the question.
I think we have a question in
Where
here.
is it at?
Pamela, you want to unmute real quick? You can go ahead and ask your, and I see Virginia give a thumbs up as well. So why don't we do a little recap of the DSP stipend stuff?
Yeah, do you want me to share my screen?
Yeah, why don't you do that? Let me make you a co-host.
Okay, let me get my folder up.
I keep forgetting that we... I will say as well, you guys got the message about the DSP stipend because so many people reached out about it right away. And again, kudos to Michelle and our accounting department for really working to operationalize this, because other regional centers have not yet, and they're trying to figure it out, even though there's tons of them that are starting to come into some regional centers. So go ahead, Michelle.
Okay, it is loading, so give me 1 second. Okay, so just a quick summary. I know that we've talked about this in the past. Share. So the DSP stipend directive that we received September 12th, just a brief summary. So that is 2 separate payments for your DSPs when they go onto the ARCA Learn website right here. Log in, create an account with your vendor number and the regional center. So it's 2 payments of total $775. $625 goes to the DSP, and $150. Let me go down. Excuse me. Where is it at? Right here. $150 is an administrative fee to the vendor. So I've been working with accounting. We do have our DSP stipend at altaregional.org. Please email any questions you guys have. And then I wanted to open just to share with you guys. So we haven't received any reports yet. They are supposed to come in on Monday. So I'm thinking in the next week or so, we will start getting those reports. Hold on one second, or my word's opening up a little slow. So with that report, you will receive a letter. So here is our letter, just letting you know. John, can you see that?
Looks good.
Okay. So once we receive the report and your vendor number is on there, what we will do is send you this confirmation letter, and it will have all the staff and all the training. So what we need from you guys is this to review this, and in those boxes, or just confirm yes or no for those DSPs. And we will also have the agreement with that. So the stipend agreement will only need to be signed one time. You don't need to sign one for each DSP. So once we get that confirmation, we have 30 days to fund that, and accounting will be doing that. So we'll be tracking that as well.
So Michelle, real quickly.
Yeah.
So no need to have the agreement done in advance. Like, we're going to get the DSP list, and then when we reach out to you, you're going to get a copy of that agreement. You're going to get a copy of that other letter, and return that back, and then that's what's going to get you paid initially.
Correct. Yes. Yeah. So we don't need the agreement right now. We're going to send that electronically through Sign Now for you guys to do. We have had some questions that we've proposed to the department and kind of to get some further clarification. I haven't heard back on that yet. I know that I followed up again yesterday. So I'm hoping that we can hear some additional information on, like I said, we had some questions on social rec direct support, also some EOR respite direct support, and then certain programs that have dual funding like Alta Regional and Medi-Cal. We wanted to get some further clarification on that as well.
Okay. Let's see here. Let's Summer House, Julie. Does that answer your question? Tasha's got a question too. Go ahead, Tasha.
Sorry, looking for the mute button. Just to confirm, the DSPs then that are attached to our programs, that's an automatic process. You get that and then you email us, or should we email you our DSPs?
So the ARCA Learning Management System will generate a report that DDS sends to us. So everybody that's been on there and completed it, that's the list. So yeah, you don't need to. But again, if you are not hearing from us and you had a DSP for some reason that had done it several weeks prior, then just go ahead and send an email to the DSP stipend at Alta Regional, and we can follow up on that. My team, Belinda and Raven, will be doing this with me. So we're in there every day. So there should not be a lag, but just in case we have that contact.
Okay. Thank you.
Cool. And Julie, I see your message. Thank you. That did answer Julie's question too. Eric asks if anyone from a regional center is working with ARCA on this. Yes, Michelle Duchesne is. She doesn't realize it yet, but she is. Because all of her stuff got sent over to ARCA by Lori. Because again, I appreciate that we've got it kind of operationalized. So Eric, if you do have feedback or others have feedback, you certainly can welcome to send it in. I would just encourage to send it into that DSP stipend inbox, just so that it gets separated from the other emails that all come in about everything.
And I'll put that email in the chat as well.
Who is it sent to at our organization? It would be whoever signed up for the ARCA Learn, right?
Who is that the report sent to from DDS?
I don't know. Pamela, can you unmute and ask that question?
Ready to attack at any moment.
Yes, it is. Who is that list going to be sent to weekly as it comes out?
So as far as Alta Regional will be sent to me, and I believe John was the secondary contact. As I don't remember reading, I don't know, maybe John, if you had that information, if it'll send that to the provider as well. I don't have that.
Yeah, I don't know.
My question is, when Alta Regional sends that list out to the provider for verification, who is that list sent to
So
at the provider?
It will be sent to the primary contact in our SANDIS for that particular vendor.
Okay, thank you.
You're welcome.
And we have 30 days. So what happens if we don't get in touch with these people? Do we have to reconcile and track people down?
We have 30 days from confirmation of email. 30
Ah,
days from the provider. So, but we will be reaching out. We're not just going to send out one time. So we'll reach out in the following week. We will follow up with you. And then if we don't hear something, we can always try to reach by phone and see if there's an additional contact.
okay. The turnaround time, what is the turnaround time for us to receive a reimbursement? Within 30 days is when we need to pay it out after the email confirmation occurs. Are providers required to submit individual stipend agreements per vendor number for each program home? It seems like you would attach it to
Yes.
whichever program the DSP works for, and if they work for multiple, I don't know what you would do.
So they're only able to be funded for 2 classes. So even if they work at multiple programs, it would be whoever they registered for. So that's one of the sorting tools with the spreadsheet they send us, is we'll be able to see the staff. And so if they put it in for multiple vendors and they took 4 classes, we will kind of, you gray those out, and they're only able to have 2 payments of those.
Okay. Other questions that folks have? Cool. Let's start getting people paid, and then we can really talk about how well this is working. Another month or so, and we'll see, because we'll see how many emails end up coming in and on Monday. And Eric, yes, please go ahead.
Just one thought. Something I'm trying to figure out is if this absolutely has to be paid time to the DSP to do these trainings. Not because I don't want to pay my people, by the way. I think what I'm wondering about is the logistics, and let's say trying to make sure that people get on the, like we do a lot of respite, for example, right? Or day programs where they're already working an 8-hour day or close to it, and then you have to figure out when to do this overtime. Just like it becomes a logistic nightmare. So I've been wondering if providers are considering having this always be paid time, or I was thinking about basically proposing with the paid stipend, if they did it on their own time, we don't have to track it. But once they do that, I could also add to the DDS stipend, right? So let's say the training is an hour each, right? So for each training, I could also add an hour of pay or add something to it that way, just so that DSPs are less stressed out about trying to do this during work hours. They could do it on their own time. They could do it whenever is most convenient to them and still get paid. I think that almost might be easier on everybody. So that's something I'm thinking about. Does anybody have a final answer on if this is like,
I'd like to revisit this discussion maybe again next week too, Eric. Just because this is the reason why I like to do this meeting, is so that you guys can talk about these types of things and be able to talk about what your thoughts are. Andrea, yeah, go ahead, please.
I also have a concern with the, it's not that I don't want to pay my people, right, either, but I would love to give the stipend, but it becoming a regular rate of pay issue. Yeah. As well as when that comes around. So if it's paid time, that's fine. We're going to do paid time. We have a lot, especially in SLS, where people are doing exorbitant amounts of hours of overtime. So getting $1,250 in 1 week will make that overtime premium an amazing amount towards your sick time, towards your overtime. So we're kind of I went through my risk management lawyer saying like it kind of looks like a non-discretionary bonus. So there's like some kind of those things to figure out too before I'm like jumping in, but also want to do it legally. So that's a concern on top of the next sort of thing.
Just something to consider, the logistics of doing it, even if they get paid the same amount or even more, but the logistics, the admin, maybe we're trying to figure out the best way to run it out so people can do it effectively, not cause legal issues for the company, not frustrate everybody by doing it. So those are some of the things our company's thinking about with Andrea.
Yeah, I feel like if I was part of like a big group like California Disability Services Association or like California Community Living Network or one of the others.
Just one of those, huh?
One of those, I would maybe think about, trying to get together with other folks statewide and talk about this a little bit. You know how it's going to work. The regional center is not going to give you guidance on this, and DDS probably won't either. And so that's why I love having these meetings again. So if we can, do we have a PAC meeting coming up as well, where possibly this could be discussed? Because I know we'd like to, I know we like to talk about things over there as well. Perfect. I'll be gone for the next PAC meeting. Let's do the discussion then. Again, let's have these discussions in here, please. As folks think about this, especially, if you're looking at it for your business, would love to share feedback. All right. Anything else for folks? I don't see anything else in the chat.
John, did we address Terry Corey's question? I know she was having issues accessing her billing this morning, and she just wanted to know if the group if the group had experienced that.
Any
If so, we'll definitely let our accounting folks and our billing folks know if people are having an issue.
I will say, and again, e-billing is a separate system. Our computer systems have been a little challenged because we're now migrating everything over to the cloud, and so all of our staff are getting 360 installed on their computers, and we're running both our Teams, Microsoft Teams now, and we have Avaya, our other system that most of us are not super happy with. So I know that's causing some issues with some of our computers, but that probably shouldn't impact e-billing though. So if you still have issues though, please reach out to our accounting department and just let them know your fiscal assistant if you haven't, and they can look into it, Iqbal and them. All right, well, thank you all very much for the discussion today. Again, I think the DSP workforce initiatives are all going to be things that we're going to be talking about, in the coming weeks. We definitely want to have discussions about the DSP internships, which our regional center is also going to be an early adopter of or piloter of. And so we'll be sharing that with you all as well about the DSP internship program. All right, everyone have a fantastic weekend. We'll look forward to talking to folks next week. Take care. September is over.